Barbara Higgins. If you guys went to the fall rally conference, you might recognize her. You might her name. She has a name story. Barb is a native of New Hampshire. She was a Division I athlete at Boston University, where she earned a master's degree in elementary education and physical education. She has been a teacher and a coach her entire career. She's an active member on the Concord School Board and is a coach and CrossFit athlete. Lastly, she has a weekly podcast, 1,000 Tiny Steps, that talks about finding joy in tragic moments. She's a wonderful storyteller who has gone through extraordinary experiences. She's a mother of 3 children from ages 21 to 2 and lives in Concord, New Hampshire. Please give it up for Barb.
How is everybody? I can't stand behind a podium, sorry. So if you were in the fall conference, I'm wearing the same dress. I don't dress up much, so this is what I have. Covers it all up. So thank you for having me. It's very inspiring to be here, and here's why. I'm going to be 60 in July, so I'm not young. How many of you have grandparents who are 60-ish? There you go, see? So I graduated from Concord High School. I was in theater in this very auditorium. And I have a lot of firsts in my life. Some are great and some not so much. I was the first high school girl to break 5 minutes in the mile in 1981 on the track up the street. Still hold the school record here. So I have that. And then I went to BU, and in 1981, Title IX was new. Title IX was legislation that assured equity, so to speak, for men and women and boys and girls in a variety of ways. For me, it was athletics, and so Boston University was offering all these full scholarships. So I went to BU, and I was BU's first Division I All-American. So athletically, I came into my adult life feeling pretty good about the body in which I lived. It wasn't always that way. I had asthma as a child, I still have it. And there were no inhalers back then. If you had asthma, you wheezed until you couldn't breathe enough to go to the hospital, you got a shot of epinephrine, your heart pounded, you threw up, and you went home. It was a very different way for treating asthma. And I remember my pediatrician saying to my mom, well, it's a good thing she's a girl, because she'll be easier to slow down. And that stuck with me because although I wore dresses every day and looked all prissy, I climbed trees and dug in the dirt, and my best friend was Bobby, who was definitely not a girl. So I had a hard time with that. I didn't understand why it was better for a girl to have asthma than a boy. And it was not a fault of the doctor. He was telling my mother something that made sense at the time. If you're asthmatic, don't run around, makes you wheeze. She's a girl, she'll be easier to placate. Some of the most feisty people I know are unplacatable women. So throughout my life, I've had a very, very close relationship with healthcare. So here I am talking to you, and I'm not a healthcare professional. I cannot give you advice on how to be an excellent nursing student or how to pass your medical boards or any of those things. But I can tell you that every day of your life in healthcare, you're going to see me. You're going to see patients, little patients, big patients, rich, poor patients, black patients, white patients, all manner of people you're going to see in your practice every day, all the time. And so sometimes these are the people to listen to most carefully. In my adult life, I've had probably 15 surgeries anyway. I beat the crap out of my body as an athlete. My feet have been operated on several times, 2 disc surgeries, a hernia repair, tonsillectomy at 21. What else now? I have more. And then 2 craniotomies. And so I'll talk about the brain tumor surgeries in a bit. So throughout my adult life, I maintained my athletic reality. I love to run. I like to work out. I had a traumatic job loss, and I jumped into CrossFit, which is a crazy, wonderful sport. What I like about CrossFit is what I'm seeing here. You guys are all connected. You have spirit and commitment to what you love, and CrossFit community is that way. So athletically speaking, it's like I found my high school track team again. A group of people in the gym every day that want to make each other better and make themselves better. And that's what I hear here, and I really like it. Congratulations too to the UNH folks for bringing HOSA into the college realm. It's really necessary. This is what will make healthcare better, not necessarily all the courses you take in college, although they're important. So I was late into having kids. I was never going to have them. Then finally I did. So I lost a baby at 36. He lived 25 weeks in my belly, and off to heaven he went. And then a year later I gave birth to Gracie, who graduated from Concord High in 2019, and 2 years later Molly, who would have graduated in 2021. When Molly was 13, she started having bizarre headaches and weird behaviors. She lost a ton of weight. She was skinny, 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 and we went to the doctors again and again and again. And the doctors did what doctors do. They looked at what they saw, they listened through the lens of their eyes, and made very accurate assumptions about Molly. she's too skinny, she's stressed out, she's 13, it's hormonal. All of those things were logical. My opinion is what they didn't do was look beyond what they saw. Okay, let's make believe she's not a skinny 13-year-old girl. What else might cause these problems? For Molly, after 16 hours in an ER, a brain tumor ruptured in her head and killed her. So she didn't get to come to Concord High and graduate. That was a life-stopping moment for me, and I'll be very honest and say for 2 years after her death, I did nothing but medicate myself, sleep, sit in a chair in my yard, and try to make sense of what had happened to my child. I hope none of you ever go through that as mothers or fathers or siblings or health professionals. It's scary. During this time, I started to have a dream, and this is where my sort of medical connection to you will all come in. So I started having this dream that I should have a baby, and it was a pretty insistent dream, a repetitive dream over and over again. Every 2 or 3 weeks I'd have this dream. So of course what I thought was I'm nuts. Okay, I've lost a child, I'm grieving, I gotta quit drinking, I don't know what I gotta do, but I'm having these weird dreams. And so I ignored them for a few months. And then I couldn't ignore them at all anymore. I was actually driving in my car and was driving by Runlet, which is where Molly would have been in school at this time. And this major loud voice in my head said, "Have the damn baby." Okay, I'll have the damn baby, whatever that means. So I went to my nurse practitioner, a wonderful woman who I had seen for 30 years, my OB/GYN nurse practitioner. And I had my pap smear and all my tests that I had to have. And I was 53 at the time, so sort of approaching menopause where all the reproductive stuff goes to sleep and old age commences. And I told her my dream and what I was thinking. And again, she reacted in a way that she felt was responsible. She scolded me, she told me I was nuts, not in those words, but she basically said, "You're clearly grieving, you're clearly not right mentally. My suggestion is you find a therapist." So I did, I found a therapist, an amazing therapist, a psychiatrist. So you go to medical school to be a psychiatrist, maybe that's where one of you will end up one day. She was amazing, this woman named Elizabeth, and she was an amazing therapist for me in those months and years after losing Molly. And I shared my dream with her, and she didn't find it bizarre at all. She was much more willing to sort of let me talk about it and flow through what it might mean. So I followed the directions of the dream, and I looked into what it would mean to have a baby at 53. So what I learned was that most fertility clinics don't talk to women who are over 49. So if you're in your 50s, that number says no. So I did some more research. I found a good friend of mine who had a lot of medical issues, and she steered me to a clinic in Boston. And so I met this wonderful doctor in Boston who said, "Well, we don't go over age 49, but there is a clinic in Stoneham that helps women in their 50s. So I went to Cardoni Reproductive Health. So let me tell you about Vito Cardoni. Vito Cardoni is as Italian as he sounds. He's in his late 70s, has helped countless women get pregnant and have babies through IVF and IUI. So all those fertility supporting treatments that women and men can go through if they can't make a baby the normal way. So I met this wonderful man, and I went through all of this testing. The testing was significant. So I had to have an EKG, I had to have a mammogram, I had to have a colonoscopy. So all of those doctors play a role in my life, the ultrasound techs and the imaging specialists. Maybe that's what you'll go into. Maybe one of you in here will do mammograms on women in your career, or ultrasounds and those sorts of things. All of those tests came back fine. Kenny, Jack's dad, had to go through several tests as well. He had to make sure that he was healthy. And I remember sort of wondering about this, what does it matter how healthy he is? Well, the reality isn't lost on the fertility specialists helping older women have babies. I've been told by many women that my decision was irresponsible because Jack will change my diapers at a very young age. And, maybe he will, but we don't know in life. After losing Molly, I realized that there is nothing known in life, really. Things happen, and you have to be ready for all of them. So I went through the whole process, and of course it was very costly and pricey to make a baby. IVF treatments right now are very, very expensive and cash only and not always covered by insurance, and it limits the number of people that have this opportunity. So I know how lucky I am. At the time I first started this process, I didn't have any money. Molly had only been gone a few months. I wasn't working. Our family was a disaster. So for 2 years, I put it aside. This is not going to happen for me. I'm not supposed to do this. And during those 2 years, I spent a lot of time just trying to survive. We had a lawsuit against Concord Hospital, and I can't speak about any of the details of that. It was a very, very painful, troubling experience. I learned a ton about the medical profession. Good things and bad things. To me, all necessary and wonderful in terms of helping me become more knowledgeable about my process and my role in my health and the health of my children. So the lawsuit ended, and it had been done maybe a month. It was June of 2018, and I had the dream again. The dreams had gone away. Like I couldn't do it. So stop sending me these dreams. I can't make a baby right now. Leave me be. And they did. The dreams went away. So I'm having coffee in July of 2018. So Molly's been gone just over 2 years now. And I say to Kenny, hey, guess what dream I had last night? And he looks at me and he goes, the baby dream. Yes. So we restart the process. So not surprisingly, I was on a number of pharmaceutical drugs to keep me okay up here. So I had anti-anxiety meds. I had meds to help me sleep. I had meds to stabilize my moods. I had panic attack medication. I had antidepressants. Lots and lots and lots, a very long list. All of you, at some point in your careers, will deal with people taking these medications. It's just a part of how we manage mental health right now. I will say, those medications kept me stable enough to care for Gracie and to get up every day and live my life. I'm not on any of them now. And that's because you can't grow a baby when you're heavily medicated. So I began a 3-month process of going off all of those meds. I have unbelievable respect and humility and love for addicts that come clean, because going off prescription meds that were prescribed to me was the most difficult thing I've ever done. Sleepless nights, hands and feet tingly, panic attacks that I had to talk myself through. It was unbelievably difficult. And it took about 3 months to safely come off all that medicine. During that time, my face began to hurt. So I have a nerve condition called trigeminal neuralgia. You have a nerve in your brain, your trigeminal nerve, it controls your face. And I had a condition where the nerve fires all the time. So for about 3 years leading up to Molly's death, I felt like I had a toothache all the time. So the way that they treat trigeminal neuralgia is through anti-seizure medications. It shuts the nerve up in your brain. Can't take that and make a baby either. So I had to go off all of this medication. In the process of going off the anti-seizure meds, so I had gabapentin, which is more of a nerve block, Tegretol, Topramate. Those are all medicines used to treat this condition. I realized I wasn't going to be able to do this. I couldn't have this much pain and have a healthy pregnancy if I could even get pregnant. So I found this amazing, amazing doctor in New York City named Imad Eskandar. So he's from Turkey. There's a theme in the major doctors in my story here. They're all from other places. So Dr. Eskandar said, go have this MRI, and if you have the condition in your nerve that I can repair, I will fix it for you. So I went and had an MRI. So I come home from my MRI appointment, I'm sitting at my kitchen table, and the phone rings, and it's my neurologist here in Concord, and I'm thinking to myself, this can't be good. You don't get good news an hour after an MRI. No news is good news in this regard. So those of you that work in the MRI field, God bless you for the tricky MRIs that you'll witness one day. So my neurologist calls and says, you have 3 brain tumors. So I'm sitting at my kitchen table. Molly's dead from an undiagnosed brain tumor. It ruptured in her head and killed her in the ER that day, 2 years prior. Kenny, Jack's dad, needs a kidney transplant. He's getting sicker and sicker and sicker. And Gracie B is trying to be a happy senior in high school here at Concord High. That was the longest phone call of my life. And as stunning. Can you hear me? Did it die? Well, can you hear me anyway? I can yell. All right. That was as painful and as stunning a moment as the doctor telling me Molly wasn't going to wake up. Because I simply felt like, you've got to be kidding me. Seriously? I haven't gone through enough already. And my big concern was Gracie. When Gracie tells that story, to this day I still cry. Val, are you still in here? So one of her teachers was helping us with the technology earlier. Yeah, I'm back. So this was her senior year, so she's supposed to be happy, right? How many of you are seniors? So you don't need all this drama in your family during your senior year. You have enough, right? Turning 18 and going off to college is all you should be thinking about. So I called the doctor in New York thinking, okay, he's not going to want to see me now. And he says, no, come right down. So I went down to to White Plains, New York, to a hospital there, White Plains Hospital. And he sat, no?
Sorry. Okay.
It's all right. And he sat with me and took my hands in his hands and simply said, we'll take care of you, don't worry about it. And he was the kindest man ever. So I began a love affair with New York City. When I went down for that first appointment and he looked saw all those brain tumors, he set me up for all my pre-op. Now keep in mind, I had no money at this time still. We had we had settled our situation and had money coming to us. But at the time, I was on Medicaid for health. I had some New Hampshire Healthy Families Insurance, unbelievably supportive group, but they don't cover brain surgery in New York City. And this amazing hospital took care of it. They just took care of me. This is important, you know, you've been through enough. So on January 10th, 2019, I had my head cut open and a big giant brain tumor taken out. And that was fine. I recovered very well from it. It wasn't cancerous. Molly's wasn't cancerous. But a non-cancerous tumor can cause a lot of damage if it's located in a tricky place. Mine was right where your eye and ear, auditory and optic nerves meet. So had it continued to grow, I could have lost vision, balance, those kinds of things. I didn't have any symptoms from it. I just had the mouth condition, which was completely unrelated to the brain tumor. 3 months later, I had my head cut open again, this time over here, and he repaired the mouth condition. So I'm yapping away at you right now, pain-free. And that's because I had this amazing doctor who listened to the whole story and not just to the woman sitting in front of him. He also had to sign off on me being healthy enough to have a baby. So he's cut my head open twice. And he has to sign his name on a document that says, yep, she can do this. I was 55 now. At 55, she can have a baby. So that's not lost on me. There's a lot of medical practices and hospitals and doctors' offices that would put a lot of pressure on a doctor like that not to do that, because he's signing off. It's his signature saying I can do this. So I never, ever, ever have lost my gratitude to him for believing that this body that has had 90 gazillion surgeries and all could also grow a baby. So I went back to the IVF process and I gave it a shot. The great thing about COVID and IVF is you can create a baby in separate rooms. So they, you know, they have the sperm, they have the egg, they mix it up in a petri dish, they keep it safe until it's ready to be put inside the belly. So that was an incredible process for me. And in that process, again, nurses, nurse practitioners, receptionists, people that answer the phone and answer your questions when you're worried. The number of health professionals in that piece of my journey are too many to count. Whether you're a phlebotomist one day and you draw blood, whether you're an LNA and you empty bedpans, whatever it is you do, all of it matters. All of it made me able to stand here today and tell this crazy story. So my first round of IVF didn't work. And in the process of, between the first time and the second time, Kenny, Jack's dad, got a kidney transplant. The story around that, quickly, Molly died and she was a dancer and her funeral was a big variety show. And in the first number of that show, a girl named Rachel, who also graduated from Concord High, was a dancer. She had a peanut allergy and ended up going into anaphylaxis and not surviving that. And her family gave Kenny a kidney. So Kenny, Jack's dad, has this kidney given by a girl that danced with Molly. And now we have this amazing relationship with this family. How can we not? Because Rachie is inside Kenny's belly. So medical professions. Some of you might be transplant doctors at Mass General one day. Maybe that's what you'll do. Maybe you'll be a dialysis tech and you'll help people on dialysis. All of these people play a role in my story. So afterwards, we retried the process with a much healthier Kenny's contribution. And in July of 2020, I went for an IVF transfer and got pregnant. So I was 56 when the transfer was done, 57 when the positive pregnancy test came back. So I grew a baby at 57 years of age. Not bad. I had an amazing pregnancy, but I couldn't tell anybody. Anyone who knows me knows I have a big mouth, and it was really hard not to tell anyone. So I did the whole 13-week thing, don't tell anyone, 13 weeks, don't say a word, didn't say a word. At 13 weeks, Dr. Cardoni, my Italian hero, stops being in charge of me and my baby, and I come to Concord. So I have Dr. Chaudhary, who is a man of Indian descent, here at Dartmouth Hitchcock, and he is my OB. And he had to say, yes, I'll take care of Barbara should this pregnancy work. And so it works. So I go in for my 13 weeks, and I want to know what I'm having, and I want all the details and everything else, and he's like, no. No. You can't tell anyone for 22 weeks. So that's, 9 more weeks. I'm like, excuse me? I can't tell anyone. So I told my CrossFit coaches, because I'm working out every day and I felt like they should know. And my CrossFit community was probably the first to know, because it's kind of hard to hide a growing belly in a CrossFit gym. It's pretty obvious. So I continued to work out, I continued living my life. At about this time, right around 15 weeks, we told Gracie. And logically, Gracie was horrified. She was 19 at the time. Worried about me physically. She's gone through enough. Kidney transplants and brain tumor removals and all of that. really, Mom? Really? You're gonna do this? And so I'll be honest, the pregnancy was hard for her. And it gets to be. I'm not in charge of how she reacts to things. And she had a hard time with it. But I had this amazing pregnancy. Here are some things that stand out for me. Every insurance bill I received denied coverage. And the reason for denial of coverage, age, diagnosis inconsistent with age of patient. So, I had an ultrasound that looked at a baby, but we won't pay for it because you're too old to have had that ultrasound. So it was a glitch in the paperwork, it was a glitch in how the computer was set up, but I had to call the insurance company again and again and again. Where are my purple tie people? Are they in here wearing their purple ties? So I always say some guy with a purple tie at a desk in Connecticut should decide what's best for me as a patient. As health professionals, you will have these struggles as well. Your word sometimes will be less important than the insurance company covering what your word says to do. That's a tricky part of healthcare. Practice your communication skills. It will help you. So I go through my pregnancy. I have to constantly say, yes, I am that old. The other thing is a lot of tests that I had couldn't be calculated in the computer because the age was too high. The software wasn't designed to take a 57-year-old woman and put all that information in to see what levels were normal and what was safe and what was unsafe. It was pretty amazing. I went through all of the tests. The biggest surprise in all of those for me was I had to have a fetal echocardiogram. It's where they look at the baby's heartbeat. And I had it at Children's Hospital in Manchester. So the baby that I lost at 25 weeks died from a heart defect. And I had the same test there, 21 years prior. In the process of going through that fetal echocardiogram, I talked to the woman doing it, told her all about Molly. They knew Molly. Talked about baby Gordy, and I knew that I was having a boy now, so I knew his name. We would call him Jack. The cardiologist comes in, and she starts asking me very pointed questions about the baby that I lost in 1999. Come to find out, the woman that was looking at my current baby, Jack, had performed the autopsy on my 25-week baby Gordy 22 years ago in Philadelphia. We had donated his body to Philadelphia Children's Hospital so that we could learn from his heart defect. So here's the same woman that now is meeting both of my children 21 years apart, 22 years apart. So things like that happened all the time. It made me believe that this whole journey was somehow bigger than myself. So on March 17th, my due date was April 13th, I was fine in the morning and I wasn't fine in the afternoon. And I developed a condition called preeclampsia. So those of you that go into OBGYN, you know that preeclampsia is high blood pressure, your blood platelets get weird, you start swelling up. I was suddenly like a balloon. So I had to deliver Jack early, I had to be induced. So I had this amazing team of women. I had a 19-year-old LNA, I had two nursing assistants, I had 2 RNs, I had a nurse practitioner, and I had the OBGYN. Concord Hospital smothered me with care. I was Molly's mother after all, and this was a pretty big thing happening in their hospital. It was the most amazing weekend of my life, and let me say one more time, whether you're a bedpan emptier or a brain surgeon, your piece of the game is no less or more important than the other one. Find where you can be the most meaningful piece. If you're not a good communicator, work in a lab or be a surgeon where you don't have to say too much. If what you do is comfort people well, then choose a way to practice that in the medical field. All of it matters. I love all of those people equally. When I look at the week Molly was on life support, some of my most touching moments came from the people that brought food from the cafeteria. Those people are there too. Everyone in that realm has a piece that makes the other pieces work. So Jack was born on March 20th, 2021, so he just turned 2. Easy delivery. I'm able to nurse him. I still nurse him. A couple of doctors told me I was too old to nurse. I'm like, well, I grew the baby, so clearly I can nurse him if it works. And it did. I'm lucky. I'm unbelievably lucky that I can breastfeed a baby at my age. This whole story is crazy, and not all the patients that you see in your career will be like me, but some of them will. And if you can take anything from what I'm saying, always look at your patients beyond what the numbers say. Molly was looked at as a skinny 13-year-old, and that was as far as that went. If I was only looked at as a 55-year-old woman who had gone through menopause, I wouldn't be here today talking. I had doctors that were willing to look around what was right in front of their faces and make decisions that ended up giving me this beautiful baby boy. I'm really excited for you all, I really am. The final thing I'll say, and then I'll let you go on to your fun stuff, is part of Molly's legacy is to help others who are going into healthcare. So again, I will say, Molly wasn't mistreated, but she was treated in a way that didn't take into consideration other things. So we do a scholarship here at Concord High School, $13,000, and so anyone that goes to Concord High, you're a health professional here, so if you need help with college. And it's for people that are going into healthcare. So what I'm thinking, because I'm looking at a room full of beautiful people, is that if you're from a different high school and you're going into healthcare, and you're going into healthcare because you definitely want to make something better for someone else, feel free to apply for a Molly B scholarship. Molly would want anyone who really is dedicated to taking care of people to be able to do what they want to do and follow their dreams. Her big mission as a 13-year-old was to make people happy, and she was very good at doing that. So, again, I just want to say, I think it's awesome that this is how you're spending a Saturday. I know it's going to be Tuesday, which is a day out of school, it would be way more fun, but you're here on a Saturday morning when you could be sleeping or doing whatever it is you might normally do on a Saturday morning. It's impressive to me. I got teary-eyed when I walked in. So good luck in your competition. Good luck in choosing a college and finding your place in a profession that takes a lot of heat sometimes. You're going to love it and hate it, and that's the way that is. So thank you.